The Open Shots podcast is a mature audience's podcast. Listener discretion is advised.
Once again, what's going on, DMV? You know what it is. It's that show. You know about that show. You missed us. It's 2 weeks later. That bi-weekly, that podcast you want to hear. You know you want to hear about it. You're about to hear about it right now. It's Open Shots. I'm your host. I'm normally on here with my co-host, Rick. But, you know, coronavirus and shit. So, brought on a special guest by the name of
Sean Taylor. And I am shotting on or taking open shots on Miller Lite.
Right on. So how are your past couple weeks been, dealing with coronavirus?
I came into this whole thing watching the NBA, and as they got serious about it, that became my tone. So my biggest thing was I didn't want anybody bugging me for stuff. So I made sure everybody took it serious. So I don't get calls that, hey man, you got extra toilet paper, you got extra this. So I was all the way ready.
Right on. All right. Well, that sounds pretty serious. I mean, we got a lot of cases that's going on right now. We're going to get into them numbers. So once again, this is Open Shots. You can hit us up at openshotsdmv@gmail.com. I'm your host, Alex, along here with
Sean Taylor.
Yeah, it is that show for the day. It is March 29th, 2020, and it is Open Shots. So we got a couple topics we're going to get into. So umbrella topic, coronavirus. We're going to talk about the symptoms, what to do, local and federal response, the numbers, New York City, what it's looking like, response from the administration. Our second topic is going to be insider trading in terms of members of Congress who were able to take advantage of information that they got at the federal level. The third topic is going to be the statement of grandparents willing to sacrifice themselves for the economy of their grandchildren. And the fourth thing we're going to get into is the stimulus package. So there's definitely a lot to talk about, definitely a lot of issues we're going to get into. So let's start right now with, and I am actually on my computer, so Rick, I know you probably hate me on this because you're like, where's the computer? What is where the computer's at? So what the CDC is telling people to do is in terms of COVID, for our listeners, if you're feeling symptoms potentially of COVID-19 or coronavirus, is fever, cough, and shortness of breath. So if you're feeling those, you may have the symptoms. That doesn't mean that you have it, just feeling the symptoms. So we have to understand we can't overflood the medical infrastructure in this country. So when to seek medical attention. If you have trouble breathing, if you have persistent pain or pressure in the chest, if you have new confusion or inability to arouse, if you have blushed lips or face. So pretty much you're like you just got hot real quick. But regardless, trouble breathing, persistent pain or pressure in the chest. And I think that this is what's it called, like a nasal infection or something like that is how a lot of people are describing it. So, Sean, Mr. Taylor, what's going on? I mean, is it true? I've heard people saying it's a hoax.
Well, going back to what I said earlier about the NBA, right? The NBA is a global organization. So they have offices in China. And when they seen what was going on in China, they were getting scrutinized at first for not being prepared, for not having the readiness. So the very same readiness we could scrutinize them for, we seen it when it came over here. So not only is it real, not only is it not a hoax, but you can also look at the fact that the NBA being a world organization, they were able to connect with other players, other associations. Because, I mean, let's look at the reality. We got guys in China who are playing, who are in America.
Well, is there any playing going on in China right now? Because I think.
Well, no, I'm saying at the start of it.
In general.
Yeah, in general. So you had guys who were, rather they had a season going on, they were practicing, they were doing something. They have the ability to go back and forth from China to America because they work in China, but they might live out here. Their relatives might be out here.
Right.
They were born here.
Yeah.
So when this first happened, Adam Silver's concern was, I could be trafficking people who could potentially have this virus, bringing them back and forth.
Very
so they
smart.
jumped on it.
So he has smart people.
Very smart people. And on top of that, you have someone like LeBron or a KD who might have had a teammate that's overseas. And they're like, hey, let me go see LeBron when I get here. Let me go. You know, so now all of us.
We talked about Rudy Gobert and then
Exactly.
his teammate. So
yeah. So what if you had somebody who's from overseas and they come to the States and they go see a team doctor, and that team doctor goes sees a player?
Well, that team doctor's been treating so many players. So
exactly.
Yeah. So the NBA, in your opinion, were the first to get ahead of it.
They got really ahead.
That whole
it was Mr. Weiss. He's in charge of.
Well, this is great. You're bringing it up on Open Shots. Hit us up at openshotsdmv@gmail.com. But one of the things that you said that is the criticism for why are NBA players getting these tests, and you're a proponent of it. The NBA got ahead of it, and they have been able to somehow sustain it in terms of their numbers.
Well, not to mention slow it down, because if you look at someone like a Rudy Gobert,
two players on one team, it just translates in terms of what it really is and what's going on. I think that just look at those numbers: professional NBA players in the NBA, and two people got it on the same team. So there's a lot of interaction between.
No, well, not it's only the interaction. It's how many kids would not die to go get an autograph from him. You know, so I think the seriousness of it is when you have people who are celebrities or influencers. They have to influence to say, hey, this is serious, let's not do this. And they have, in a sense, a priority, which I know a lot of people disagree. They're like, why aren't we touching the teacher, the doctors? But I think at the end of the day, anyone can replace a teacher. If we got really bad with the whole healthcare thing, you just have to step up. Like, people would have to just say, hey, I took it when I was in high school, maybe I can help. But that's where we come to. But when it comes to people doing the jobs of these sports figures, there's only a few people in the world that can do what LeBron does, that can do what Rudy does.
Well, we're not talking about what they can do as athletes.
We're talking about
the response from the NBA.
And this is
approach.
And this is how it plays into it, because a lot of people, they're upset that these guys got priority or whatever first.
It just happens to be that their union, literally was like, this is what we're doing.
Exactly.
For everybody.
Exactly. Yeah.
And we're a part of a union, and this is how it's going down.
But they're also a solution as well.
Yeah.
Because they're going to be the ones who are donating money. They're the ones telling people to stay at home.
They're the ones who have international programs.
Exactly. They have a way further reach. The NBA. So that's why I was glad they got tested, because if these guys got tested and some of them found out what they have, they'll hopefully take it more serious. They'll hopefully open their pocketbooks more. They'll hopefully, like the one guy, Towns from the Minnesota Timberwolves, his mom got really sick and she could die. So now... he's very, very vocal about what's going on, and he's really trying to make an impact. So as far as them getting tested, them being out there, I think that's way more than what me or you could do.
Right. I agree. I totally agree. Yeah. All right, so let's get into these topics on Open Shots. It is March 29th, 2020. Happy Corona's fever. Happy COVID-19. You know what I'm saying? We still got to get in between. The only reason we're recording is because we actually live in the same house. So that's why we're recording. And and not too many people moving around nowadays. So, you know what I mean? Get it in. You try and get it in. What are you hustling nowadays? The photography? What else? The live events? The videos? What's up?
Well,
if you ain't gonna plug yourself, let's get into these topics.
Well, before we get into topics, I just love to say, I had a barbecue in the backyard, the other day. I offered you a plate.
Friday night.
And I honestly think my barbecue skills are now becoming legendary. So by the summer, you might see that on my channel, my Dark
Might see
Emerald.
a toot of train smoke of just like, wow, what's that?
I mean, it's trust me, it's really good. And I think I'll try to put on their recipes that everyone can do, everyone can follow. So, with 2 years from now, I think the whole entire country will be making
giving
what
away
I
the
make.
secrets.
Yeah, just giving away the secrets. Stuff people have been asking me for a long time.
Get in,
I'm finally
get in.
going to open up. Yeah.
All right, so we're going to get back into these topics. You know, it's Open Shots. This is our intro, Open Shots, dmv@gmail.com. So let's start with the coronavirus. So we already went over the symptoms, which is, we can get back into them. We've got shortness of breath and fever, cough, shortness of breath, symptoms. Seek medical attention if you have trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, blush lips or face. That's coming actually from the CDC website. So, at a glance.
Now, they say arouse. Are we talking what type of arouse?
Yeah, exactly. I don't know, but let's worry about the breathing and the pain in the chest, the pressure in the chest, and of course your fever. That's the biggest thing.
And keep in mind, this is very vague.
Yeah. Well,
this is very vague because we live, especially in this area. It's hard to breathe out here.
What area?
Silver Springs,
The DMV?
the DMV. You know,
DMV.
It's real hard to breathe because of all these trees, all these pollens. Everybody is taking some kind of medication for the allergies that are out here.
So to understand symptoms might be a little bit more
it's
tough.
going to be very, 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 very hard.
Okay, so U.S. at a glance. Total cases in the United States of America, 122,000. Total deaths, 2,112. Jurisdictions reporting cases, 55, 50 states, District of Columbia, Puerto Rico, Guam, Northern Mariana, and U.S. Virgin Islands. Again, this is from the CDC. So, according to the Washington Post, March 29th, the number of known coronavirus cases in the District, Maryland, and Virginia surged over 2,000 on Sunday, today, the 29th,
Montgomery County.
with 1,240 cases in Maryland, 891 in Virginia, and 346 in the District. That's today, Sunday.
I know
That's coronavirus
Montgomery
news.
County has the most out of those three.
Yeah,
and the
you
most
said it.
death.
You just said
Yeah,
it.
so that's where we at. You know, that's where we at.
Yeah.
So,
Those are U.S. numbers. Yeah, and DMV numbers.
no, I think what's kind of misleading is people with health insurance to people even without, because there's not really an incentive to go get testing if it's available, or to kind of feel that, I won't say you're covered, but like at least for me, I had an experience where my health insurance, it's $320 a month, right? And before I had it, I would get a blood test for high blood pressure, and that was $68 for the blood test, and it was $90 to see the doctor. So I'd be spending about under $150 just to re-up on my medication. Now with Kaiser Permanente, or maybe I shouldn't say their names, but it's $320 a month. Every time I see the doctor, it's $50. And one time I was having some issues. I went to see her, that was $50 plus the $320 I was spending, and they made me do blood work, and it was $540
For blood work. That's
blood
terrible.
work. That's $1,000.
Just to find out who you are. Just like,
Yeah.
I mean, just to understand yourself on a body level. I mean, that's terrible. I mean, that's insurance, man.
But I mean, it's dangerous because we're talking about trying to contain something, and we right now don't really feel financially, if you're not working, it's worth going out to spend money to find out you have a cold.
Well, I don't know about that. I know that if it is at the level what they're saying it is, then it's pretty much
Well,
like
it's
what
too
we've been
late.
doing. Like, well, I've been
Yeah,
doing this
it's-
my entire life, so it's not a big deal. Like to be indoors and like by myself, it's good.
Yeah.
I'm good with it. But like everybody else, like pandemic, you know what I'm saying? I see how it goes down in the grocery stores and no paper towels and you know what I'm saying, all that, no soap and like, all right, people go crazy. You know what I'm saying? You find another way. I would imagine because that's what I'm doing. You know what I'm saying? I still got a little bit of reserves, but it's crazy how now drivers, have their face shields and their masks and everything, which is more praise to you. And I would say I would continually address and be a proponent of doing that, especially if you're out in public. I mean, we live together, so it's different because, you know what I mean? Like, we have each other's germs.
Yeah.
You ain't sick, I ain't sick. You know what I'm saying? So I think we're good. It's just the whole, like, when you go out, because, sharing the same airspace. So if you don't have to go out, don't go out, which I normally don't go out any goddamn way. Regardless, you know what I mean? It is what it is. So what to do if you think that you might be sick from corona is to call your primary health care, your doctor, or to call an urgent care facility, or call a hospital and ask to speak with a primary care physician at that point, or a nurse, and explain to them your potential symptoms, because you don't want to overload the beds in hospitals. And you don't want to be in a hospital anyway. So don't overreact. If you think you might got it, you know what I'm saying? It's going to be another one that was like, if you think you have the symptoms, or whatever, is that you feel like you're drowning because it's like a severe congestion. So just be aware of that. You might have to blow your nose a whole lot, but but just talk to your healthcare provider, call urgent care, and don't overflood the fucking emergency room. If you can walk and you can talk and you're able to like maintain mentally, then you might want to just have to bunker down and figure it out, because there are people in need right now. So that's how I feel.
Part of figuring out is figuring it out during flu season, where that's normal.
Well, we're running out of flu season. So all right, so this is another thing. There are claims from Donald Trump about the testing and all his claims, and turns out that there aren't that many tests available. I have a friend who got his kid got to go, still hasn't gotten the results. So we're gonna have to find out what's going on with all this corona and our ability to deal with this kind of pandemic, because that's literally what it is. Locally, the DC has pretty much been like, unless you're essential, you can't be open as a business. Maryland has also done the same thing. So liquor stores still open, which is sweet, because I think that's essential.
Now,
me like punching the
Ohio
wall, or like
has banned the sales of alcohol, so it's going to be interesting. Ohio, so it's going to be interesting to see if we take that route.
Hey, then I have to load up. This entire living room be just like 30 packs.
Entirely
like a warehouse.
The way you look at it, if you are in Montgomery County and you got the highest cases and the death among the whole entire DMV,
that's right. You said it.
I can see it.
You said it because you said it. Let's go back to those numbers real quick. You said it. So because it's in the DMV, it surged above. This is coming from the Washington Post. Today, the 29th, the number of known coronavirus cases, quoting, in the District, Maryland, and Virginia surged above 2,000 on Sunday, with 1,240 cases in Maryland, 891 in Virginia, and 346 in the District. Probably read that already, but regardless, I'm reading it again.
And every time I hear those numbers, I just think those are the people who came forward. There's way more who are just like, what do I do? So I take it as the minimum, not necessarily the average or the most, but it's the minimum. And I know you're not going to like to hear this, but I can see why they could ban alcohol, because I don't want to hear that. Some people I know, they'll do, no, I'm talking.
I'm not going crazy over alcohol, but damn, no alcohol, like, I'm gonna do when I'm bored.
I'm talking about the girls I hang out with. They love to drink, and if you say, "Hey, we got alcohol," they're coming through. Okay. So it's harder.
City girls.
Yeah, them city
City
girls,
girls.
man. It's hard to keep the city girls home when they know alcohol is out there. And not to mention, it's more of being in a sound mind. You don't want to do anything like get into a drunken drive or, drunk driver, drinking and driving, you get into an accident. Now, first responders are coming out to try to say, hey, this guy got into an accident during a pandemic. Why? Because he was drinking. So I can see why this would be an issue, because you definitely want to focus all of your first responders on the pandemic and not what people are doing within their leisure times.
Okay, so I'm going to a random website right now on March 29th, 8 o'clock. Coronavirus cases in the U.S., 141,000 deaths, 2,000 recovered, 4,000. So if you ain't think it was real, it's real. We told you on the last podcast, it's like, wash your hands, you know what I'm saying? Do that thing. And you have to maintain with that. Donald Trump said that hopefully he would like to get the United States back to normal by Easter. And this whole Corona thing is affecting his plans. I think it's terrible. And then there was a church today in I can't remember where it was. It might have been Florida, West Virginia, Tennessee, one of them southern states, one of them states. And they actually had mass today. So the whole thing is like no more than 6 feet, no more than 10 people, and they had a mass, and it's like they just went against the entire hey, let's be responsible thing because of religion.
Well, I mean, you told these kids, don't go to the beach, don't do your spring break thing.
But for
and then
religion,
you go ahead
adults going to church.
Yeah, what I mean. So it's almost like you have to look at it with the same eye that when these kids went to the beach and you felt that was selfish and irresponsible. This is almost the same thing.
I think this is worse because of the amount of people that were there. And this was in the United States. Of course, it happened in the United States. I can't remember what state it was. I want to guess the South or the Midwest. One of them states.
I mean, you almost got to blame the president because
you have to blame the pastor.
Well, I say
in this situation, you have to blame the pastor. That's irresponsible.
I think
it's like no, we don't want people around each other, and then it's
actually,
like come on in, people, let's be around each other.
I actually know that in time of crisis, you have to turn to your world leaders, to your national leaders. Those people really have to step up and they have to make a clear-cut message. Okay. And this is really over Trump's head. He's just not capable of that type of leadership.
But this is what he wants to have because it makes him happy to go to church
if you look at our history,
he wants to get the economy back.
But you know what? Here's the thing. We have neighbors that say certain things you kind of laugh at and you kind of wish was true. But you look at that guy and say, man, I'm glad he's not the president because that's just not presidential. It's something maybe we all think we all can kind of agree on. Okay. But as a leader, you don't do. And this is something as a leader you don't do because you're not leading just this country. People are going to say, hey, look what America did. Let's do it too. Right now, they can't say that. And that's how we know he's over his head. When you have people all around the world that can't look to us for a solution, you know we're not doing it right.
Okay, so I have to I have some points on that because, quite honestly, this would not be predictable for any president.
I mean, if I was president, man,
if you were Obama in this situation,
well, I think Obama first of all would handle it differently because
he would have handled it differently in public. I get it, but in terms of what the federal government is doing, you can't get mad at Trump for this. This is something unforeseeable.
Well, I mean, then let's look at the NBA.
Barack did his thing. Barack did his thing when we had H1N1 and SARS and MERS and all that shit.
And he did it while fighting the Congress too.
Right.
You know what I mean? They didn't want to do a lot of the stuff he wanted to do because they wanted him to look bad, and of course they was worried about the economy. So I mean, definitely.
But I can't get mad at Trump for this because it just happens to be what's going on.
Oh no, it's
what I can get mad I can't get mad in terms of like the economy and all that. It just happens to be. But what I can get mad at Trump for is for being like, by this date we're gonna do it, or like we're doing other things over here. there is no timeline or a date on this. According to scientists and engineers, there is no timeline or a date on this. It has to die out because everybody's going to have to stay inside.
This is what I would have done.
In quarantine.
I would have said straight up, this is not a hoax. This is not a joke. Right. We're going to go on a 2-week quarantine. We're going to get these guys from Congress. And this would have been after I sat with the doctors, and I would have said, it's right now. I'm giving you the opportunity to use what you have, the knowledge you have, to help make a decision to move this country forward. And whatever I came out of that room with, I would have stuck with it. Okay. You know what I mean? It would have been hard as nails, and I would have said, hey, national emergency, no joke, no playing around, shutting everything down. Okay. And I would have done it in a way where I would have let people know that this is going down, and I would try to move my chess pieces in play.
So here's some numbers in the United States, and this is going from worldometers.info. Cases in the United States, total cases, 59,000 in New York, 13,000 in New Jersey, 6,000 in California, 5,000 in Michigan, 4,000 in Massachusetts. The number of new cases in New York today, 6.2 thousand, and in New Jersey, 2.2 thousand new cases. Number of new deaths, total deaths, New York 965, New Jersey 161, California 131, Michigan 132, Massachusetts 48, and this goes by the number of new cases. New deaths, New York a plus 82, New Jersey a plus 21, California a plus 12, Michigan a plus 21, Massachusetts a plus 12. A plus 4. So yeah, if you didn't believe that it was a hoax, these are numbers, and numbers make sense. I would think. So, all right. So, what do you think the administration is doing in terms of their front line? Does the buck stop with Donald Trump? Should it be at his front door? Should it be at the front of his administration? What are surgeons generals doing? What Dr. Fauci? Shout out to Dr. Fauci because he's actually out there, logical, doing his own thing, regardless of what's going on. Because I believe he has so much support from the community.
So, yeah, I like.
Say it. Speak, brother. Speak.
I like Dr. Anthony Fauci, but at the same time, I honestly believe as a large participant within the scientific community, he really shies away from politics.
Being controversial.
Absolutely.
Yeah. He has to. But unfortunately, at this point, it's a health crisis. That's tough. Yes, I get it. I totally get it. You know what I mean? Because your entire life is like, I don't want to go to the galas. I get it. I'm feeling them. Because the entire time, like, you're being professional and just doing whatever you want to do. Like, just imagine it, balling, or if you've ever done it, balling, and you just only do whatever you want to do. And it's like, come to a ball, like, nah, not really feeling it. Come to a soiree, nah, not really feeling it. Come to an open house, I still think I'm good. You know what I mean? That's kind of him because of he's not really rolling with that whole Trump, like, we balling in Cadillacs. Like, that's not me. I totally get him.
And
I just want him to keep speaking his mind, and keep being honest.
Part of the reason, though, why I also feel he's that way is because as a scientist, you're being told that you don't know all the answers. Well, he's a scientist. He is a scientist.
He's a scientist. Okay, so everything you're dealing with is theory.
It's theory, and a lot of really high edge, the on the cutting edge type of scientists, they're always being humbled to be that way. If you listen to Neil deGrasse Tyson, same thing. They're always trying to say what we know, but they'll follow that by saying we really don't know. This is our best guess. So you can kind of see he still brings a little bit of that mannerism with him, as in, this is what I would have done, but I'm not sure. We got drugs that could work, but I'm not sure. Theoretically, they should work, but I'm not sure. He's always saying, hey, I'm not going to be the one that sends my knights or my pawns out there because I'm not sure of this move that I've seen done a million times before that could work. You know what I mean? So he definitely brings that attitude. But Trump has to
keep talking. Trump has to.
But Trump he has to be more sure. You know. One of the biggest problems I've been looking at when I first started watching this, I was really serious about it because, like I said, I know people are going to turn to me for stuff, you know, and I wanted to be ahead of it so I can say, hey, I got this and I got that. Maybe I could help you out. But I know you had some of the stuff of your own, it's less burden on me. So I was definitely ahead of it. And I felt that he hasn't taken that attitude. And part of me being ahead of it was I followed the stories. I was watching this CNN to even ESPN just to see what the NBA was doing. I was reading a lot of their articles to see how they were handling it. And I really felt that the information that was out there was kind of hard to, well, I guess the best way for how I can say it, everything wasn't like the same. You know what I mean? Like I would hear people are dying and then people aren't dying. You know what I mean? So I guess the word I'm looking for is there was nothing that was...
Contradiction?
No, not contradiction,
Appealing.
But consistent.
Consistent.
There was nothing really, really consistent. And now I'm really at the part where I'm reading more and I'm watching more stuff because I'm trying to figure out who's telling me the truth and who's lying to me. And once again,
cross-referencing is important.
It's very important. And
it's
once
important
again,
well, academically, but just in life,
it comes down to Trump.
Like you heard this from that person, because then you have to also check with the other people.
I mean, it's a main skill that they teach you
happened.
in college. It's like one of the first things for your general elective. For those who didn't go to college, they want you to know how to pick a source, to pick a reference, to be able to weed out bad references from good. But still, even going back to Trump and his mannerism, I watched how he was attacking the media, and people were like, it's not a good look. So he came back the next time, and he was like, oh, the media's been wonderful. They've been nicer to me. Because I'm not going to lie to you, I listen to a lot of Trump. You know what I mean? He's the president.
To the enemy?
Well, it's not the enemy or anything. He's the president. So you have to listen to him. So even if you don't like him, that's where you can get all of the fuel for your material of why he's bad is you have to listen to him. You can't say, I hate him, I cut him off. And then when people say, why do you hate him? You're like, oh, well, because, well, you can quote stuff he says. You can quote the policies. You can quote everything he's doing on a real-time basis if you follow the stuff that he's doing.
Great points. Excellent points, actually. Mm-hmm. All right, so that's our coronavirus, our first topic, which was an umbrella topic, and we're going to get into 3 more other topics. But in general, wash your hands, hand sanitizer, you know what I'm saying? Lysol, everything down. Wash your dishes, wash your face, wash your ass. Hopefully you'll do it. I'm just kidding. But I'm not in that situation. I love living solo. How you love living solo?
I guess. You know, and I really don't like it. Well, you know what? Here's the funny thing.
You need a wife? You need a wife?
No. I'm really a loner, right?
Yeah.
I'm really a loner, but at the same time, even though I stand out, I like to blend in. So, I can drive wherever I want to go.
You're not blending in with Redskins gear at my parties. Just kidding. When the DMV, shout out to the DMV.
Shout out to the Baltimore Ravens too, because I mean, we are basically FedEx
but
Field.
You're a Skins fan.
Oh, big time. But I mean, at the end of the day, it's like I love football so much.
Open Shots. This is that show. Hit us up at Open Shots. DMV@gmail.com. I'm your host Alex, coming along here with
Sean Taylor.
Sean Taylor's still here, and we just wrapped up our Corona umbrella, topic. We're gonna move on to the next one, which is insider trading. This is coming from the New York Post, and I'm quoting the New York Post. Last week, it came out that 4 U.S. senators, including Republican Richard Burr of North Carolina, and Democratic Dianne Feinstein of California sold hundreds of thousands of dollars worth of stock in major companies after they were given a secret briefing on coronavirus. Insider trading or not? That's
not.
insider trading.
Not.
That's
I would
insider
say
trading. Wait, hold on. You go into a security briefing, and then after that security briefing, you unload stocks on something that you know is not about to last. So that's insider trading. If I do call it, sir, that is insider trading.
I mean, the thing I look at when you hold a position nobody else holds, if they allow you to buy the stocks and they still allow you to have that position, then it's kind of hard for me to imagine that it's not normal for people to say, oh, this is about to go bankrupt. And there could be like 30 people in the room that have that stocks, and they're going to be like, oh, we're just going to watch it go bankrupt. I don't think reality works that way. What I do think reality works is if we said, hey, this stock is about to go belly up, and then I go on TV and tell everybody everything's just great, then I sell. Now that's a problem. You know what I mean? Like if you sell it,
did Martha Stewart do that?
I can't remember all of the Martha Stewart case.
If Martha Stewart didn't do that, then
I think I
you kind of got to go by Martha Stewart standards at this point, because it's Snoop Dogg on Martha Stewart standards. Martha Stewart, I think, did more time than Snoop Dogg. You know what I'm saying, for insider trading, which is like I got some inside information,
and
I got to sell it or buy it, and she did that. A lot of these people got security briefings from the federal government and were able to take financial advantage of the information they had. Is that insider trading or not?
I'll say no, for the simple fact, like
how is it not insider trading?
For the simple fact that I don't believe with just pure, I guess you could say, intelligence. That I could own Amazon, a large stock in Amazon.
Yes, okay, fine.
And be on the board of something, and you tell me Amazon's about to go belly up, and I just sit there and be like, "Oh, I'm about to lose all my money."
No, it's a different thing from being in a board meeting than being in the federal government.
It doesn't matter, federal government.
It's a huge difference.
Anywhere where I can get
you're getting the most intel in terms of so many different levels, like the FBI,
so do you
federal
really,
government, marshals. Like, I mean, that's who you're if you're at that level as a congressman, you know who you're working with, and you know different levels.
But I would say the insider trading to me would be more of if
that's insider trading.
I'm sitting at the board, right? I'm a Congress member. They gave me the information,
I go to a conference,
and then I call my family and I tell them, "Hey, this is about to happen." But when you're sitting there as, the Congress people...
As soon as you do it, as soon as the conference is over, and this is a conference on information, as soon as the conference is done, you're making financial changes.
Well, okay.
That's insider trading.
Oh my goodness.
I don't even know how you're arguing me on this.
I'm arguing on the fact that if I'm sitting on a board that has information before the general public does...
Okay.
That's kind of like, okay, so all of a sudden, let's reverse it. Let's say Amazon is about to blow up. So I'm sitting on that board and I get that information and I can't act on it. I don't think that's realistic. I don't think there's anything in play that tells people they can't do that. Yeah, it's even more than realistic. I don't think there's any way a group of people can get information before the general public, and they're in charge of some type of oversight.
Who was it? Feinstein, and it was somebody else.
Well, the Republican lady too. Like because she's really. I was watching some videos that they did on her, and she's just a crooked character.
Republican Richard Burr of North Carolina and Democrat Dianne Feinstein of California sold hundreds of thousands of dollars worth of stock in major companies after they were given a secret briefing on coronavirus. A secret briefing. A secret briefing. A secret briefing. This is coming from New York Post. Gotta believe this one.
Yeah.
They throwing fucking congressmen in the motherfucking quotes. So that's insider trading.
No,
if you make money off of information that you got to sell stocks to make money, that's insider trading. Do we have to go back to the textbook?
This is what I'm saying. They sit on the board, right?
Okay.
On this Congress board that they sit on, and they get the information, and then they don't act on it. It just doesn't seem realistic. It just doesn't seem something that they've never done before. What we're talking about, this is the first time a congressman has done something like that? I don't think so. You know what I mean? I honestly believe
I agree.
This happens all the time. So to me, it's really what could they have done different that would get them in trouble to what they've done in the past. And I don't see anything unless they said, hey, they call their family member up, because now it's a little different. You know what I mean? If you're getting the information and you're acting on it, I'd be like, well, he's on the board, whatever. You know what I mean? But if you're now going around and capitalizing off of it by telling your parents and their friends and all of them, and now they're starting to like create this chain of event, then it starts becoming unfair, because it's like only the people you know are benefiting. But for how I've always seen stock trade and all of that, it's always the people who are like in the circle. They can do that. Outside, who aren't connected, that have nothing to do with it, that's when it becomes a problem. That's when it becomes out of hand. But as far as the people in it, to me, they're in there. It's like, that's gonna happen.
So there has been a lot of rebuttal in terms of, just like ignorance in terms of social distancing. So I have an issue. Montgomery County basketball courts, they're taking them down. Like, what's that about? Like, I mean, I totally get it, but like,
about hard-headed Americans. At the end of the day, it's like you can go to other countries and you can say no one can play basketball, and they're not going to go and play basketball. But you say that to America, no one's going to play basketball. They're going to be like, oh, you're going to take my guns next. So, I mean, that's what we got. You know what I mean? We got the hard-headedness, and it's always going to be in the places where maybe more higher populations or higher crime, or where people feel like, hey, this is essential to containing the virus, because if these kids get together and play basketball, then they go to their jobs and they have to bring food or something to elderly people. You know what I mean? We're saying that we killed some people because we didn't want to take down some basketball courts. You can't do that.
All right, so moving on to the next statement. There was a statement by a congressman who said that grandparents were willing to sacrifice their lives for economic gain for their grandchildren. That's coming from a senator.
Well, you know what? I'm going to blow your mind like those joints Jamaican people smoke. You know what I mean? I'm going to blow your mind. Jamaican. You
Gotta be Jamaican?
Well, because I got
Jamaican,
rosters.
Money on the two.
I got rosters in my
three,
family.
You know me.
And I see what they smoke, man. So this is gonna blow your mind. We have a country that doesn't have a good healthcare system.
Yeah.
Doesn't have a good educational system. We just lack a lot of stuff. We're like we're ranked in the 30s in a lot of the stuff that we run around thinking we're like in the top 3, but we're like really way down there. And part of it is because the older generation didn't really leave a legacy or anything for the younger people to latch onto. So I kind of laugh at it.
I disagree with that, because I think you're first generation, and I'm first generation in this country. I think that I've seen Americans who have had their generations in this land. So I kind of disagree with that one.
I mean, it's like, one of the things that was overwhelming is when Pearl Harbor got bombed, what they were able to do to get things back going, right? That's pretty generational. But as far as just lingering on to that, you still have the healthcare issue, you still have the educational issue, and then you have enormous debt. Where you're saying, oh, you can't do this, we don't have the money. Oh, you can't, no, we don't have the money. Oh, we can't do this. That's what we're leaving these kids to. So now we're asking the same kids that we can't give them a lot of shit on to stay at home, to not enjoy yourself, to not have fun. You know what I mean? So that's kind of where I say, I'm going to blow your mind with this one, is because I think the mentality of the kids now are like, oh, the old people. And now you're saying, hey, you got to look out for the old people, and you got to sacrifice losing financially, not going to work, and not being able to do the stuff that your broken livelihood has, because you can't afford this. Like, everyone can't afford a car, they got Ubers, can't afford the house, they gotta live, with roommates or whatever. So you have this messed up lifestyle that the older generation has given, and the older generation is saying, hey, can you guys stay at home? Can you guys lose money? Can you guys financially suffer so we can live longer? What are you gonna do? Live longer and keep on screwing
Wow,
us?
that's a theory.
I'm like,
that's
really.
A theory.
I mean, I really think of it because when I look at the kids' attitude, they just don't care. And why don't they care? Because they're like, middle finger to the baby boomers. It's like, we know there's that tension that the younger generation blames the older generation for taking away all the opportunities that they have. And these opportunities that the older generation
They blame them for taking away?
Oh, big time. Big time. Because, listen to an older guy. An older guy will say, oh, why can't you go to school? Well, when you went to school was $10,000 for a college degree. Now it's $250,000. You know what I mean? How are the kids today supposed to figure out how to pay for $250,000 for an education of education when, as a lawyer, within the older generation lifetime, they could have done that for 60 or less. So what did they do to make it jump so high?
That's why you're so burning.
Exactly. So
free education.
I mean, I'm gonna be honest with you.
Well, I can't get mad.
I hope to be
a Republican
governor
in the great state of Maryland for giving
Larry Hogan,
the first 2 years of college to Maryland residents. So first 2 years of community college.
Well, I mean, that's what it's going to have to become.
I'm down with that kind of Republican.
It's going to have to become.
I'm down with Hogan. He's good. He's been doing his job.
Because we're globally competing. That's what it comes down to. I've worked with guys who are just like, oh, I hate all these education for free, but then they get a boss from Iran or Iraq or someplace like that where they really hate, and then they're like, oh, why is this guy? He's a foreigner. Why is he in charge? It's like, well, better educated. You know what I mean? Where we can't get our guys to go to school, become educated, and then become leaders. So someone from a foreign country, and they have every right to do that. You know what I mean? There's nothing wrong with foreign people taking the advantages that anyone can take because it's within the rules. But unfortunately, because of the way of how we set stuff up, we make it very hard for our own people to get ahead. And then we have other people who are from elsewhere who are now our bosses. And then we treat them bad. So then they start treating people who are more like them more favorable than ourselves. So it's a grave that we're digging ourselves. And it's going to come down to free education eventually. It has to. Or start learning a different language. Start learning Chinese. Because that's who's going to be your boss. Let's keep it real.
All right, so we're going to get into our last package, which is our last topic, which was we just ended up with. All right, let's run you back. We just ended up with grandparent sacrifice. Mm-hmm. That's what we just ended up with, and before that was insider trading. We started off with coronavirus, the umbrella topic. Symptoms, what to do, don't overflood the ERs, talk to your healthcare provider or call urgent care and tell them about your symptoms and monitor your symptoms. Wash your hands, isolate yourself if you can. If you do feel sick, stay away from, people who are not used to being in the same environment as you or a controlled environment. Local and federal things are going on, so don't be surprised if a lot of things are going to start closing down. I think it's probably going to happen. New York City, that's a lot of people. Normal Easter, Donald Trump. Umbrella series, still Corona. And administration response. Then we moved on to insider trading, grandparents sacrifice. Still the show. It's Open Shots. Hit us up at openshotsdmv@gmail.com. I'm your host, Alex, along here with
Sean Taylor.
Sean Taylor in the house. What's the name again?
Sean Taylor.
Tell him again.
Sean Taylor.
Tell him one more.
Sean Taylor.
All right, so we're going to look at that exciting Corona stimulus package. So, this is coming from Politico. All U.S. residents with adjusted gross income up to $75,000, $150,000 for married couples, would get a $1,200, $2,400 for couples rebate payment. They are also eligible for an additional $500 per child. The payments would start phasing out for earners above those income thresholds and would not go to single filers earning more than $99,000. Head of household filers with one child, more than $145,000 and more than $198,000 for joint filers with no children. Why it matters? People who don't pay taxes, such as those with very low incomes, may be hard to reach the way the program is designed. Hospitals get their wish, $100 billion. What they got, the healthcare industry. Healthcare providers would secure $100 billion in grants to help fight the coronavirus and make up for dollars they have lost by delaying elective surgeries and other procedures to focus on the outbreak. They would also get a 20% bump in Medicare payments for treating patients with the virus. Why it matters? The figures is exactly what three powerful groups representing physicians, hospitals, and nurses had demanded. Though for-profit hospitals were lobbying for so much more. But there are still questions about whether there will be significant guardrails on how the money will be split up. Airlines, $58 billion. What they got, airlines would receive $29 billion in grants and $29 billion in loans and loan guarantees, as well as a reprieve from paying 3 of their major excise taxes on the price of a ticket, the fuel tax and cargo tax. That funding comes with strings, though. No stock buybacks and limits on executive compensation. Price for retaining payroll. Businesses would get a tax credit for keeping idled workers on their payrolls during the coronavirus pandemic, so long as the businesses meet certain criteria. They would get a refund for half of what they spend on wages up to $5,000 per worker. State and local governments, $150 billion. What they got? The agreement would provide $150 billion for state and local governments, with $8 billion set aside for local governments, which are bleeding tax revenue as only essential businesses remain open and unemployment claims climb by the tens of thousands every day. Yeesh, must be tough to be a city manager right now. Pentagon Plus, $10.5 billion. What they got, the Defense Department would field an infusion of $10.5 billion, including $1.5 billion for the National Guard, to deploy up to 20,000 on-call soldiers to help state response teams fight the coronavirus over the next 6 months. The bill would also spend $415 million on research and development work at the Pentagon, aimed at developing vaccines and antiviral medicines. The minimal aid for insurers, fund to offset big losses stemming from the pandemic, as well as premium subsidies to help fund temporary COBRA coverage for laid-off workers. They got none of that, although the legislation aims to protect them from price gouging. Let's read that one more time. Minimal aid for insurers. Insurers wanted an emergency fund to offset big losses stemming from the pandemic, as well as premium subsidies to help fund temporary COBRA coverage for laid-off workers. They got none of that, although the legislation aims to protect them from price gouging on coronavirus testing. And you can't get the test as all the tests back. So yeah, there's a lot going on. That's pretty much the basic stimulus package. Do you think we're overspending? Do you think we're spending in the right places?
I think it's a bad deal.
Think it's a bad deal? Why?
Well, for starters, it's $6 trillion, right? So we have six.
Two, I thought about 1 and 2.
No, it's 6. It's 2 is what's supposed to be, I guess, like money, and then 4 is what needs to be liquidated. So altogether, it's 6 trillion. The 2, of course, which is the main important one, because that's the one that's telling us that
2 days ago
you're gonna get like paper, stuff that folds in your pocket. So
no, they're getting checks. If everything's going digital,
you know what
I think
I mean.
everything is going
You know what I
digital
mean.
now.
Pretty much, it's what you could spend, and the other 4 is what the Federal Reserve has to liquefy. You know what I mean? Yeah. So, I mean, we're talking about bailing out a country. It's just the Medicare program by itself. The Medicare program is expensive. It's close to the trillions or in the trillions. So a bailout just for families and some of these industries, it's going to be way over $1 trillion. So the thing $2 trillion is almost like the numbers kind of don't add up.
I mean, there's always the questions of, and once again, this is Open Shots. Hit us up at openshotsdmv@gmail.com. I'm your host, Alex Long, here with
Sean Taylor.
Sean Taylor, tell them about it.
No vowels.
Yeah, all right. So this is that show. Hit us up on the emails. One thing, what I was thinking about was just in general, how many people are not going to be able to come back from this? You know, like bars closing down. You know.
Well, I mean, like I said, it's a bum deal because it's not really going to guarantee a lot of this. But I mean, we live in a country where once one fall, one comes up, and we also live in a country where you walk through
we're
Detroit.
Dealing with the virus.
I mean, still, it's
different.
like there's always people that are waiting for an opportunity to take advantage of a bad situation, and there's always the people who never recovered. Like go through Detroit, and it's just broke down. It's like you're like, oh, what is this building? Oh, that used to be popping when Motown was popping, but it's no longer in existence anymore. So there is that fear that some of the stuff that we see and that we used to have could disappear and never return, because we see that all throughout the country. But like I said, take advantage of a situation like that. So I think a lot of these people who got bailed out, the corporations that got bailed out, if that's their interest, on this package. Oh yeah, because it was very
COVID
friendly.
Package.
Yeah, it was very friendly to them. It really hooked them up. You know, if that's the avenue they want to take, there's that opportunity. But more than likely, a lot of these guys who are on top of these capitalist guys, they tend to not want to invest in some of the things that we like because it's a small town feel.
Well, I mean, this is another thing, and to our listeners, I think this is important for the type of work that we both do, because the type of work that we do can be viewed at and is sometimes emergency. You know, like to the grocery store worker, to the registered nurse, to the doctor, to the physical therapist, whatever. You know, you have to be pretty smart to be able to make it to that level, and I know you're pretty smart as well. So it's really tough right now, especially if you're out of work. Keep listening to us. You know, we're a bi-weekly podcast. There just happens to be a special guest by the name of
Sean Taylor.
Yeah, and you can reach him at.
Oh man, we'll get back with you on that.
Yeah, okay. Too many emails to remember.
Yeah.
But yeah, we're getting on with it, and that was the Corona stimulus package. Once again, this is that show, Open Shots. This is March 29th, 2020. It's been that show. We're gonna recap coronavirus. It's an umbrella topic. We're talking about symptoms, what to do, local and federal mandates, numbers in other states, New York City. Donald Trump talking about Easter and what Donald Trump's administration is really actually doing. Insider trading, grandparents, and Corona stimulus package. Anything you want to say there?
My biggest thing is I think because of how this wasn't handled within like 2 weeks ago, all the things that should have happened, how they're happening now, I think this could go last longer because of that.
I agree.
You know, and I mean, just package that we just signed is going to be a gut cruncher, and we're going to need another one. So I mean, man, we've always talked about what would it take to make America fall, and this country is great and it's going to be able to survive a lot. I mean, we're really, really putting ourselves in a hole where our biggest problem is we say we're the best at everything when really we're just the best at confidence. Nobody can beat us when it comes to confidence. Anything else, man, we're not the best at. And if we can't look at that and say, hey, we're not good at this, then we can't make strives to improve. And this virus, the COVID-19, it's going to be a test to see, are we going to wake up and start realizing that we just have a lot of flaws and we need to address it? And if we can come back. If not, I mean, this is how great empires fell. Just the arrogance of feeling that they couldn't fall.
Well, I think just a couple of rebuttals to your argument is that, number one, we're not the only country feeling this virus. This is a global pandemic, and it also affects global trade routes. So we are all dealing with this. India, China, Japan, it's just, there's a lot of people who are dealing with this, not just Americans. So let's look beyond that. In the meantime, keep washing your hands. If you're cool with people and, you kind of already have the same germs anyway, I think it's good because that's why it's working right now. Because my co-host, by the name of
Sean Taylor,
is over here. And so we hope you enjoyed this show. We had a couple different issues, couple different topics we wanted to get into. We hope you enjoyed it. Any kind of last words?
No, not really.
No.
Just
wash your hands.
Yeah, I guess
Lights
we'll
off.
see. Hopefully, come winter we ain't talking about the same thing.
Come winter, come fall, we talking about football.
Yeah, hopefully,
Right on. So once again, chilling with Sean Taylor over here, and we gonna call it a night. We hope you enjoy this show. We gonna make it last. And honestly, now that we got coronavirus, we might be doing these on a weekly basis because just getting bored. So, but y'all be safe. Keep washing your hands. Keep doing that liquid alcohol. Keep doing regular alcohol. Still looking to get sponsored. This is Open Shots. Who are you again?
Sean Taylor.
And I'm Alex V, and this is Open Shots. And we are going to talk to y'all in about,